Welcome to the Therapy Trainings Podcast. I'm so glad you're joining me today. I'm excited to dive into a companion episode to the course titled The Neurobiology of Addiction Understanding Brain Changes and Recovery, offered by Therapy Trainings. This course is a treasure trove of information, and in today's episode, we're going to explore some of the key points, additional insights, and even address some common misconceptions about addiction. Now, if you're a mental health professional, a counselor, or a therapist, you already know that addiction is a complex issue that affects not just individuals but families and communities. Understanding the neurobiology of addiction is crucial, as it allows us to better support those struggling with substance use disorders. So, what can you expect to learn in this episode? We'll discuss the brain's role in addiction, the changes that occur due to substance use, how these changes impact recovery, and we'll also touch on some myths surrounding addiction that can hinder effective treatment. Let's jump right in. One of the foundational concepts in understanding addiction is the brain's reward system. This system, primarily involving the neurotransmitter dopamine, is designed to reinforce behaviors that are essential for survival, like eating and socializing. However, when substances are introduced, they hijack this reward system, flooding the brain with dopamine in ways that natural rewards cannot. This can lead to the compulsive behaviors we see in those struggling with addiction. Imagine this. You're having a particularly stressful day, and you decide to unwind with a drink. Initially, that drink might help you feel relaxed and happy, but over time, your brain starts to adapt to that influx of dopamine. It begins to require more of the substance to achieve the same feelings of pleasure, a phenomenon known as tolerance. And that's where things start to get tricky. It's not just about the substance anymore. It's about the brain's chemistry and how it's been altered. The course offered by Therapy Trainings dives deeper into this topic, examining how different substances affect various regions of the brain. For instance, opioids primarily impact the brain's reward pathways, while stimulants like cocaine can enhance dopamine transmission in a way that creates a very different, yet similarly dangerous, pattern of use. Understanding these distinctions is vital for tailoring treatment strategies that reflect the unique challenges posed by different types of addiction. Now let's talk about recovery. Recovery from addiction isn't just about stopping the use of substances. It's about rebuilding the brain and its functions. The brain is remarkably plastic, meaning it can change and adapt over time. This is good news because it means that recovery is not only possible but also achievable. However, it requires patience and support. In the course, we explore various therapeutic approaches that can help facilitate this recovery process. For example, cognitive behavioral therapy, or CBT, can help individuals develop healthier coping mechanisms. Mindfulness practices are also increasingly recognized as beneficial, as they can help individuals stay present and manage cravings. The key takeaway here is that recovery is a journey, and each person's path will look different. Now, amidst all this talk about the brain and recovery, let's address some common misconceptions about addiction. One of the most persistent myths is that addiction is simply a lack of willpower. This view can lead to stigma and shame, which only complicate the recovery process. The reality is that addiction is a complex condition that involves biological, psychological, and social factors. It's not about choosing to engage in harmful behavior. It's about the brain's wiring and the grip that substances can have on it. Another misconception is that all individuals who struggle with addiction hit rock bottom before seeking help. While some may experience a significant crisis before reaching out for support, many individuals begin their recovery journey without ever hitting that proverbial rock bottom. Everyone's experience is unique, and that's why early intervention is so essential. So how do we combat these misconceptions in our practice? Education is key. As mental health professionals, we have a responsibility to inform our clients and the community about the realities of addiction. This includes sharing insights from courses like the one offered by Therapy Trainings. Knowledge can dispel myths and create a more supportive environment for those in recovery. As we continue to explore the neurobiology of addiction, let's not forget the importance of a holistic approach to treatment. it's essential to consider the individual's entire life context, including their mental health, social support systems, and environmental factors. This is where integrated treatment models can shine. They combine various therapeutic methods, addressing not just the substance use, but also co-occurring mental health issues, which are often present. For instance, many individuals with addiction may also struggle with anxiety or depression. If we only treat the addiction without addressing these underlying issues, we risk a cycle of relapse. By considering the whole person, we can create more effective, tailored treatment plans that increase the likelihood of long-term recovery. Now let's circle back to the brain for a moment. It's fascinating to understand that while addiction can cause significant changes to brain structure and function, recovery can lead to healing as well. Research shows that with sustained abstinence, many of these changes can begin to reverse. This underscores the importance of ongoing support and therapy. Recovery is not just a destination, but a continuous journey of growth and healing. As we wrap up, I want to leave you with some thought-provoking insights. The landscape of addiction treatment is ever evolving, and as mental health professionals, we have the ability to influence change. By staying educated and informed, whether through courses like the Neurobiology of Addiction, offered by therapy trainings, or through ongoing professional development, we can enhance our practice and better serve our clients. Remember, addiction is not just a personal failing, it's a complex interplay of biology, environment, and behavior. By fostering understanding and compassion, we can help dismantle the stigma surrounding addiction and create a more supportive space for recovery. If you're interested in exploring more about this topic, I encourage you to check out Therapy Training's website at therapytrainings.com. They offer a variety of courses that can deepen your understanding of addiction and equip you with the tools necessary to support your clients effectively. Thank you for joining me today on the Therapy Trainings podcast. I hope you found this episode insightful and engaging. Remember, knowledge is power, and together, we can make a difference in the lives of those affected by addiction. Until next time, take care and keep learning.